liability to budget for it somehow or another, rather than just waiting for them to decide how they want us to pay them. Because if they don't buy into our program, they say, no, write us a check.
I think our discussions with them can take place over a period of time. I don't expect that we'll be surprised with a bill saying it's due and payable next week or next month. I anticipate that those discussions will take place over a period of time, and that we will bring to our side any and all forces that we have to avoid payment of dollars, including contacting our federal officials on our behalf. That's something that we have to do. Not to my knowledge. Not like the IRS.
They're cousins.
So the most they can do is deny you similar funding in the future. And my recollection is we don't have any of these cops grants programs that we've seen. So they can put you on the list of not receiving people.
Greg, I think what Steve is referring to is should we, in the budget process, budget some amount over the next, even if this is gonna take 2 or 3 years to resolve.
If it's a third or whatever.
Just so that when when we do have to face recognition of this exposure, that we have built up some surplus to deal with.
Maybe another account.
Definitely looking at it. Yeah, it's a good idea.
Okay, any other police-related questions? I know we're later than we had hoped, but at the same time, I think it's been extremely well prepared and valuable exercise.
Thank you.
Thank you for the efforts. We're gonna take a 5-minute break and,
Thank you, Chief.
You're welcome. Thank you.
I like how the chief.
Like the
Thanks.
situation,
Lieutenant.
Question is, what does the fire department do? The fire department in North Reading does whatever it needs to do for the community itself. We're a very diverse group with trained individuals. We do fire suppression. Under that would be ladder operations, pumping operations, water supply, interior firefighting operations, exterior. We need to know about building construction and how to keep our people safe, and electrical. After that, we do fire prevention. The deputy is in charge of fire prevention for the community. He oversees plan review. He's also works with fire alarm plans, works with the building inspectors group to make sure that the building is being done under strict guidelines, be it the town of North Reading, the state building codes. And we have to know building construction and what happens during an emergency, and we have to be able to rectify that problem prior to. That's the job of the fire prevention officer of the town of North Reading. Along with that, he also is the juvenile fire setting officer. He works with the state, performing juvenile intervention. We have some child that lights a fire. He works with the state task force team to rectify the problem. He's also working right now with the detectives in the police department. He's just gone through a 4-week course with the new detectives on arson investigation. He's also working with a regional training team to develop a training operation that will be regionally performed. Along we go to that, we go to emergency medical technician. We're also the ambulance department for the community of North Reading. And we have to know what to do in the time of an emergency. We run the ambulance. We have to know which emergency room is open for us and what the best possible care is for the patient that we're taking care of. Our average ambulance run is approximately an hour and a half from the time we go out the door until the time we come back. So our personnel that's working on the day shift is gone approximately an hour and a half on the night shift. We keep our records. under the Healthcare Reforms Acts and so forth of 2000. Everything has to be kept up to date. We have forms that we have to keep track of. We're going towards a new computer system to try to go paperless under the ambulance system. We're trying to move our computers into our ambulances and into our fire engines so we can get off of the paper system and into better record keeping. Also, underneath the fire department, we do emergency rescue. We're the water rescue company. We do high angle saving. We're right now getting into trench rescue. Trench rescue is a new diverse program that's coming out from the state. There's new guidelines that people that do trench have to have a permit. The permitting process will probably start January of next year. And we have to do a training program to be ready for that and to be able to go and save people in trenches. They recognize that under OSHA as being one of the mandates. Also, we do vehicle extrication. Also, we have 8 personnel who do trench rescue high angle, and they're starting a training program. They just came back from Hopkinton. They're out there for a 2-day seminar doing trench rescue. The department also does vehicle extrication under car accidents. We do lockouts for the community. We work with the police department very closely in emergency operations with child being lost, problems that they're having in a domestic situation. The firefighters work closely with them in taking the people to the hospital. And we train on all aspects of our job, and all the time. Our ambulance work is approximately 730 calls a year. We do approximately 1,300 to 1,400 calls for service other than ambulance calls per year. At this point, the department is run with a chief officer that works days. He has a secretary who works days. She's an administrative assistant. The deputy works a day shift schedule. He's in fire prevention. He's a day shift person. He works with the building inspector. We have 4 shifts that run 24/7. We have a captain and 3 firefighters on each shift. And those 4 people are backed up per shift in case of an emergency where we need extra help that will not be available to us other than the 4 people by transmitting a box alarm and bring people in off duty. We have a complement altogether of 18 people. We also have 9 call firefighters who work on a per diem basis. When they're asked to, they come back on callback. They also have a training program that's done twice a month. They approximately get 8 hours a month, and that program is instituted by the deputy. The deputy oversees the program along with 2 other firefighters, and they train and try to keep tuned with everything that's going on. I also have an EMS trainer, and Michael Tanyan. He's a firefighter. He's an intermediate person. He's 1 step ahead of most of the department. Most all of our men are EMT trained. And what he does is he sets up training for the EMS division. And that's pretty much exactly what we do. We do whatever we get a call for.
1,300 other than ambulance calls.
Yep.
What's the mix of those? I mean, what are the major components of those calls?
Calls for fires, calls for assistance, community assistance, basically. Fires, suppression, fire alarms, lockouts.
Lockouts meaning someone's locked out of their home?
Out of their home, out of their car. We do car lockouts also. Anything that has to do that is not EMS related. Anytime we get a 911 call or a call for assistance that they need.
Of the
That does not include any of the fire prevention things that we do.
Of the 1,300, what's the fire, for fires, small and large?
I can't honestly give you that answer. I haven't, the program that we have that keeps all of that information is giving us a little problem at the moment. But it's probably about, I'd say 60% of it.
60%? I'm just trying to get a rough idea. So about 700 incidences of fires of all sorts,
Right.
basically. Would an accident be more would fall into that too, into that category?
No, an accident would fall basically under an EMS call.
And all.
The ambulance goes out, it becomes an ambulance call.
Okay. So in other words, if it's just a fender bender, you wouldn't necessarily get a call for that.
No, depends upon whether the
You know,
police
unless it
department
was
transfers.
a fuel leakage or something.
Right.
Right. Questions? Go through the detail of the numbers and.
Yep. Let's see. Where do you want to start first?
Well, I'm just gonna make a comment on the benchmarking, was that, you have 18 full-time employees, and that's what the benchmarking report says, so somewhere along the line, at least the head count was right.
They guessed one right, huh?
Well, you know, I think it's where the information comes from, and,
Yeah.
I think if you want to go over the benchmark, and I have a list of things that I found throughout the
all right,
benchmark.
well, why don't we do that, and then we'll talk about the numbers, okay?
Can I say something? Sure. If you would. What I did is I went through the benchmarking per page, broke it down, how it reflected onto the fire service. One of the big problems I had with it is that it gave us a range of 2001 to 2005, and they seemed to use different years
Yes.
for different information, and I think that was wrong. We were never asked about it prior to the town administrator just handing us out the information. So all of my information that I have here on this piece of paper goes from the information given here on the benchmarking. Page 223, I find that the fire department has increased spending by 247, while the benchmarking communities are at 242. We've increased by $5, according to the way that I go along with the benchmarking. The department increase on page 224, we have decreased by 8%, while the community, the benchmark community's has decreased by 9%, 0.9%. On 225, the fire department's increased by $18, while the benchmark communities has increased by $13. I didn't find any real big significance in these numbers. Our department on 228 costs 1% more than the benchmarking group does. And then it would cost $161 more. On 229, according to page 229, our per man costs are larger, but we get more bang for our dollar. We have the ability to get our entire department and the call department, which I had for 38 personnel, because at the time I did this, our personnel has decreased, but our call department has lost a couple of members. One came to the premise department. We have the ability to get 38 personnel, 24 hours a day, 7 days a week, and it costs more because we do not hire enough personnel to perform the task as other communities do. We keep our benefit package down. We keep our minimum manning to 4. Trying to keep our costs down, but by doing that, our overtime rate goes up. On page 231 and 235, adding all department personnel together, the average department size in the benchmarking was 26. The average benefits package for 26 personnel is $208,000. We would need to add 8 more people to our staff to reach the average, which is $64,000 more than the department, keeping the cost down by not doing that. The average department that was used in the benchmarking has 26 personnel in their department. We have 18 performing the same tasks as these departments do. We also provide an ambulance service that some of the departments do not. The larger overtime costs make up the difference. We have to hire people back. When our ambulance crew is out for that hour and a half, we bring in 2 people to maintain our staffing level to 4 people per shift. Page 234, our department has 1 station. That's half of the benchmark communities do. Our problem is they installed new traffic lights. We've increased our travel time to the fire station to get the vehicles we need to perform our tasks. We need a second unmanned